Good evening, everyone. My name is Tebogo Pule from the Global Center for Academic Research and South Valley University. The title of my topic is Improving Conditions of Service for Family Caregivers in South Africa. In most cases, chronically ill patients, the disabled and old persons are discharged from healthcare facilities to their families who have inadequate knowledge and skill. They may not be aware, they may not be familiar with the kind of care expected to provide. And this poses a huge challenge and increases the burden for the family caregiver, which ends up becoming unbearable to the point where the process is no longer a healthy or viable option for both the caregiver and care recipient. The aftercare needs of the patient may be so demanding that it results in the caregiver neglecting their own health and well-being, and therefore causing a deterioration to their own physical and mental health. Physical and psychological support from the health system is very limited and sometimes not available to the caregiver and their patient. All these challenges arise from the fact that the family caregiver, according to Gusdal et al., is counted upon but not accounted for, as their care was taken for granted while their need to be seen and acknowledged by healthcare professionals was not met. The objectives of the study were to expound the role and value of the family caregiver, to inquire and understand challenges experienced by family caregivers, to determine the association between family caregiving role and burden, to identify gaps and challenges in the South African health system affecting the family caregiver. A qualitative systematic review was conducted following the preferred reporting items for systematic review and meta-analysis, also known as PRISMA, on Google Scholar database, and retrieved articles were from 1994 to 2020. A criteria for evaluating primary studies were clearly defined at the beginning of undertaking research. A total of 1,810 articles, reports, and dissertations were retrieved, and only 85 studies were included. These 85 studies that were included were critically appraised using the WebQDA software, whereby 198 comments emerged. Both burden and challenges of caregiving experienced were categorized as problems, which came out 82 and 52 times respectively, compounding the role that they play. Other categories that emerged from the studies were intervention and outcome, which came out 51 and 13 times respectively. Interventions and outcomes were also consolidated into one group, implying that interventions would have an impact on improving or declining outcomes, and these were 32%. It is hereby recommended that further research be conducted on family caregiving in South Africa to enhance studies that have already been conducted. Specific research on challenges faced by family caregivers in terms of economic viability, financial aspects, and associated burden is hereby recommended. I thank you.